today I have the pleasure of being here with Mark Granada, a nurse that was educated in the Philippines. And welcome, Mark. It's great to have you here.
Hello, thank you, Sherry. Thank you for having me. It's a pleasure to be here. I know when I was still deciding on whether to apply to Avant or not, I was looking for resources to help me, reviews about Avant, and this is really a great resource for those who are, still on the fence, looking at whether to pursue their application or not. So thank you.
Yeah, so these were comments from nurses that were currently with us that helped you decide to come with Avant?
Yes.
Well, good. I'm glad those were helpful. So it's people like you that have come over here with us that really can share what it's like. Mark, would you share with me when your American dream started? I know you didn't come directly here from the Philippines. You went to the UK for several years, but when was it that you decided that you wanted to come to the US? You had your own American dream.
So I didn't really call it an American dream before, but it kind of started when I was in high school. I was browsing through the photos of my aunt who was in the US for several years. She was working here. I was looking at the photo and said, oh, wow, this is a beautiful country. And I was inspired by, as you know, in the Philippines, it is common for people to go abroad to help out their families. And I was inspired by her story, how she helped us out so much. So I said, after college, if I go abroad, and I'll probably be able to do the same, help out my family. And I got a nursing school scholarship in college, so that kind of paved the way for me to finish school, because it can be very expensive in the Philippines. And the US was closed at that time, so I started working in the Philippines. I took initiative and borrowed one of my colleagues' NCLEX reviewer, and kind of started looking at the process. But it was near impossible at that time, very costly and timely. So I left my dream aside. And a few years later, the UK opened, and I was set on going to the UK, settling in the UK. But then an ad on Facebook popped up from my dear Avant. And I looked into it, and I started the process. I didn't expect for Avant to be that serious and thorough, but they were. So it kind of just started the ball rolling, from the CGFNS application to NCLEX review, the NCLEX process to visa screen, then embassy, until I got here in the US. So thank you, and I'm here now.
Good. Well, we are thrilled that you're here now, and we're thrilled that you made that decision, because it does take a couple years to get here. So what is it like now for you and your wife being here in the US?
So that is one of the things that I am grateful for. Avant has helped us so much, especially with my wife's visa. So things that were very impossible before, Avant guided us through the process, included my wife in the application, especially, so we were able to get the visas together. And right now she's doing well. She's here with me, and she's in the process of applying for a license, driving license here, and we're getting to know the area more. So we are really, really grateful. Thank you.
Well, good. I'm glad she's here with you. I know that makes a big difference to have family here. We had an opportunity to talk for a few minutes before this started. And one thing that kind of struck me, and maybe you can speak to this, is, your journey here. You first went to the UK, and you know how hard it is to really start your life all over, new place, new people, new professional environment. So talk a little bit, what was different when you came to the US with Avant?
So yeah, we kind of talked about it, and um, it was very tight for me because I was in the UK. I was um, working there for 4 years already, and I got my visa here approved, and I was told I was expected to come here in January, so it was kind of tight. And when I got here in the U.S., um, I was kind of floating. So the transitions program that Avant has, so it's divided into like the cultural part and the clinicals transition transitions program. So that program has really helped me settle in. So the cultural transitions program, um, we were taught things about the American culture, how ways of life here in the U.S. And we were assigned a specialist, even cultural specialist, that helped us find apartments, find vehicles, and during that process, we were doing like driving lessons. We guided through the process until we got our licenses. And I was amazed by the Avant transportation vans that picked us up early morning. It took us to our appointments for like vaccines and tests that we needed to be done in the clinics and to the banks. And, you know, all these small details Avant takes care of. The bank opened for us very early. We were like VIPs. We were able to open accounts. So, and the clinicals helped us with like things that I don't want you to be anxious about procedures here in the US because they are the same things that we've been doing as nurses for years. But the clinicals transitions program has helped us like translate practice to like where we worked before, where you are working right now to the ways that they're done here in the US. So that's really helped. And we had amazing instructors. And that I want to mention that the atmosphere in the Avant headquarters was very warm and welcoming. So that mattered to me. Being new to the area, being new to the country, and I'm sure that is the same with my colleagues before. So on behalf of them, I want to thank Avant for just like holding our hands from the very start. Thank you.
Well, I'm thrilled to hear that because you are very courageous. You worked for years to get here. I know that you spoke about CGFNS and NCLEX and immigration, and although it sounds short, it's about 2 years start to finish. So it's a difficult process, and then you get here, and we don't want you to feel all alone. We want you to feel like you've just arrived to your family away from your family. And so I'm really glad to hear that it was welcoming for you. Now, you're at a great facility. I've been up to Ohio. They're thrilled with their Avant nurses. And speak a little bit about how that's been. I know that when Avant went in there, they had never worked with international nurses. So we spent a lot of time preparing them, preparing their preceptors to orient you. How was all of that?
So I just want to backtrack a little bit to when I got into when I got to Ohio. Someone from Avant picked us up in the airport and spent time with us, like 3 days. We were housed in a hotel, made sure that we settled in the apartments well, and we were accompanied to the facility. We were introduced to the supervisor and the nurses. And at the facility, I felt very welcome, and not separated from the other nurses. The nurses were very excited, very interested. They were asking me a lot of questions about the Philippines and what kind of noodles we eat and all that kind of stuff. But yeah, it was great. The start was great, and I felt very welcome. And our facility is very, very thankful for us, and we feel that every day. Our managers they have an open door policy, so you can always go to them and if you have problems. And I am assigned what um, I'm at the assignment right now. I'm assigned an Avant nurse manager and nature specialist. So they call us every other week or so. But they're always hands on. So it's been great.
That's great. Well, let's talk a little bit about COVID. How has COVID been? I know that Ohio wasn't part of that first surge at all, or maybe the second one in July, but I know more recently there's been more cases in Ohio. So how has that been?
There was a lot of fear at the start. I can remember back in March, no one knew much about the virus yet. But the hospital is a huge network. So what they did was they designated one hospital to take care of COVID patients. So all COVID-related admissions went straight to that hospital. So they mobilized all resources. We had to float there for staffing at times, and it came to a point even when we had overflow of patients and we started opening our own COVID units. And the hospital managed it very well. We had trainings right away for like PPEs, donning and doffing. There were bulletins every day guiding us. They started like a COVID protocol right away, what to do if a patient presents in the emergency rooms. It was well structured, and we even had a COVID crisis staffing model that we did in case cases surge and would, have limited staffing. I was part of that model, and it worked really well. But we didn't have to go to that. Now it's gotten better. The medical management, I can see we're still getting cases, but the management is getting so much better. So we're getting a lot of recoveries from the virus, and it has been, I don't want to sugarcoat and undermine the whole COVID issue, but it is also important not to believe whatever, the news, everything on the news and online. And it's really, as I mentioned at the start of the interview, that it's good that we have this resource that we can go to for nurses, especially looking at coming over. And I understand that it's scary, especially those with families and kids, because you're very protective of your kids. And I understand that there is always doubt. And, we are here to answer your questions if you need anything. And I'm sure Avant will guide you through the process.
So I appreciate that. And so you feel safe here in the US, like that you're supported as a nurse, that you're given the PPE, you're given the research, the staffing support to make you feel comfortable caring for those patients.
Yes, I am. I feel very safe. We make sure that we always have negative pressure rooms. We have portable HEPA filters in other rooms. We make sure that there's negative pressure in the rooms. We make sure that we have adequate PPEs and masks, especially. So it's very safe in the area where I'm working. And there's a lot of support. There are bulletins every day. There is a handbook organized. So that's one thing about the US is the healthcare system is very advanced. So you wouldn't worry about lacking anything, any resource anymore. I know there were struggles at the start, but now it's picked up, and they're doing very well in terms of like supplies and equipment. So it is safe and it is managed well.
Good. I'm glad to hear that. And of course, you're on the front line. You're seeing the patients come in and, seeing, the preparations that are being provided for you and your coworkers. So you were talking a little bit about encouragement for other nurses that are considering coming over here. Now, outside of work, how do you feel about the environment? Do you feel like you still have some freedoms? And I know most of us are wearing masks wherever we go, and trying to use good hand washing and sanitizing and that kind of thing.
So yes, it is mandated now to have a mask on, but there is still a lot of freedom out
Mhm.
there. You're not restricted at all to go out, so we still go out like regularly. I don't think we've cut down so much. We don't go out that much, but it's the same routine still that we follow. We make sure that we wear masks, and at the stores, there are like social distancing guidelines that are strictly implemented. So I don't think it's much affected, it's affected much the freedom in terms of going out and engaging, but we are all aware that we have to be very careful, and just like hand wash, wash your hands, and be very particular with like washing our clothes, taking them off, and all that, which come into the house. So it's not really affected, I would say, our freedom to
Mhm.
go out.
Mhm. Yeah, I would echo that. Just feeling safe enough to go out as, long as you're wearing a mask and you're social distancing. You'd be surprised what we've done in the classrooms. By the time our nurses arrive, the bigger groups later this month, we've, accommodated for social distancing and plexiglass dividers and things like that, just so that people feel safe, because that's what we want them to feel when they come over here. Is there anything that we haven't covered here that you'd like to share for the audience? Anybody that's considering applying to Avant, or deciding whether now's the right time to come over?
Um, I think being USRN is one thing, and being able to come over here and practice as a US nurse is a whole different thing. And for me, it is a dream come true to practice over here and be like a registered nurse. So if you are here right now, and I would say pray about it, and if it's God's leading for you to apply and come over to the US, grab the opportunity and apply with Avant. Because Avant is the best out there, and I am a living testimony of Avant's legacy. And Avant, as I said earlier, will hold your hand from the very start. We're still holding my hand up until now, and I'm so much grateful for that. And nurses here you have so much opportunities for growth, advance your career as nurses, so you'll be able to maximize your potential as a nurse. And I'm sure with families as well. I have other Avant nurses here who have families, and they're doing well. They're excited for their kids to go to good schools and just to learn the culture, to be able to share with their families back home too. So I encourage you to apply to Avant, and I'm sure Avant will not impose anything on you, will not rush you, will guide you through the process as they did for me, from NCLEX to your flight to the U.S. So yeah, go for it.
Thank you. Thank you for that. And, now that you've had the opportunity to see how and why nurses are the number one most respected professional in the US for many years running now. I mean, you feel that respect. Every day when I drive into my neighborhood, there's a sign there that says, "Thank you, healthcare heroes." And so thank you for being a healthcare hero. Thank you for being an Avant hero. And thanks for sharing your story today, Mark. I really appreciate it.
Well, thank you for having me. It's been a pleasure, and I know I still have a lot of things to learn. And I'm sure if I can be of any, I can be of any help to others. You just ask your questions, and if you have any questions, we can always answer them for you and share our stories here. Um, so you know more about what's life in the U.S.
Mhm. Well, thank you for trusting in Avant, for caring for the patients at the bedside, and just really sharing your American dream story. Although it didn't start out that way, but with everybody here. So thank you. All the best to you and your wife. I'll look forward to seeing you in Toledo the next time I come up again. And until then, Mark, thank you so much.
Thank you.